Good afternoon, and thank you for joining. Get myself situated. Thank you again for joining our Facebook Live. I'm Dr. Janina White, Deputy Public Health Authority with the Houston Health Department. And again, thank you so much for joining today. I want to start off by just acknowledging it is National Public Health Week. So happy National Public Health Week to all of our public health professionals. We just are so proud of your work and all your efforts. If you see a public health professional, would you just please thank them for all the hard work that they do? So let's dive right in. Just want to go back and give some updates since the beginning of this year up until Tuesday. We now have 505 cases of measles that are reported for Texas. Since the last report, which was on April 4th, we've added 24 new cases, unfortunately. Also, you may have heard in the news that sadly, we had another death of a child. This is our second death for the state of Texas. This death was in an 8-year-old girl. She had measles pulmonary failure, so lung failure, pneumonia complications, and she was unvaccinated. If you recall, our first death this year was a school-aged child in February, and that child also was reported to have been unvaccinated. Just to remind everybody, and when we initially started our measles conversation, we were looking at communities out in the West Texas community. And subsequently, there have been more cases reported from Gaines County and some neighboring counties. But we've also seen additional counties. Gaines is in the West Texas community where we saw initial outbreak. We're now seeing cases in Terry County, Yoakum County, Lubbock, and Cochran, as well as Dawson, have had a significant number of new reports of confirmed cases. And that's where we're getting a total of 505. But when you look at our jurisdiction, we've reported cases, so has Harris County, so has Fort Bend. Ours have primarily been with traveler associated, but I mentioned that because when we talk about traveler associated, we're also talking about travel within the United States and not always thinking of traveling abroad. And I want to give that perspective on travel is that if you're planning to travel in jurisdictions in that West Texas community, you want to think about your risk to get your vaccinations on time and whether or not you need to have vaccinations at a more increased interval. I also mentioned that for travel because we've had confirmed measles cases across 22 jurisdictions across the country. So there's cases in Alaska, California, Colorado, Florida, Georgia, Kansas, Kentucky, Maryland, Michigan, Minnesota, New Jersey, New Mexico, New York, New York State and New York City, Ohio, Oklahoma, Pennsylvania, Rhode Island, Tennessee, and Texas, Vermont, and Washington. That was as of April 3rd. I know prior to coming on Facebook Live, I believe Hawaii has now reported also a case. And a lot of these jurisdictions will report traveler associated. But similarly to traveler associated, it's still important to be fully vaccinated because when you're traveling, these are things such as being exposed if you were traveling on an airplane through the airport. So those are concerns where being fully vaccinated will be your best protection. And as I look to see if I have any questions, I also wanted to highlight the ages of individuals who have been infected, and we've had cases to give you a perspective of the risk. So for children ages 0 to 4 for Texas, our confirmed cases are 160, 5 to 17 years old, 191, Over 18 is 130, and there's about 24 that the age was not available. So when you think about the age distribution, we see 0 to 4 is 160, 5 to 17 is 191, and 18 and over is 130. What that really highlights for me is knowing your immunization status and all of those groups. If you've not been fully vaccinated, this is the time to get fully vaccinated. It's 2 doses. 12 months old is when you normally get your first dose. The second dose is at 4 to 6 years old. However, as you can tell with some of the situations we're having in our community and in West Texas, and depending on how you travel, you might want to go ahead and get your first dose, and then your second dose can be within 28 days. Some of our information we're sharing for Texas when you think about traveling in Texas, and I think I mentioned it earlier, but to give you a better perspective, as of April 7th, outbreak communities in Texas are listed as Cochran County, Dalem County, Dawson, Gaines, Garza, Lamar, Lubbock, Lynn, Terry, and Yoakum. So you can imagine if you live or you visit those counties, they're having measles spread, and your best protection is to get vaccinated. Vaccines are safe, and it's a 2-dose series. So the question is, I was vaccinated for measles earlier in my life. Does that immunity wear off after a period of time? Okay, so not knowing when you received your vaccine, we do know if you were born before 1957, it is most likely your immunity is there. We had circulating measles at that time, so most people will have immunity. It was around 1963 to 1967. There were 2 measles vaccines at the time. One was live and one was not. And unless you absolutely know you received the live vaccine, then there is a benefit for you certainly getting a vaccination for protection and support, or going to your provider and actually asking to have your titers done. And if you have access, if your titers show that you have a level of immunity, you wouldn't have to be revaccinated. But some individuals, it's just almost easier if you're not sure to just get a vaccine. It'll be 1 dose, and the health department has those vaccines available. Otherwise, again, knowing your actual status is important, but there's nothing wrong if you're unsure of getting an extra dose. The vaccine is safe. So thank you, Kondo, for that question. And I know this goes so quickly. We love your participation, and we just want to make sure. Well, somebody asked, was that before or after 1957? So you were born before 1957. So if you were born before 1957, more than likely circulating measles was out at that time, and you have been exposed and have natural immunity. But if for any reason you just want to make sure, we've had this question come up before, you can get what we call titers. It's able to tell you if you have immunity. For some individuals, depending on your medical concerns, medical issues, or your risk with working with maybe small babies, young children, maybe you're headed to the West Texas community and you just want to ensure a level of safety, certainly going to a healthcare provider and asking for that test is appropriate. Okay, so again, thank you so much for joining our Measles 101. We so appreciate the opportunity to give you factual information and be available for addressing any of your concerns. We look forward to seeing you at our next Facebook Live next week. And until then, have a great afternoon.